Welcome everybody. Thank you for joining us for today's webinar. Just want to introduce myself briefly and the company before I pass it along to Holly. For those of you who don't know me, my name is Katie Inouye and I'm the CEO and founder of Spark. Just some housekeeping issues or things I want to point out for today's webinar. The handout is available to you if you'd like to have a copy of the presentation in the handout section of the webinar. Also, we're happy to answer any questions that come up. Please put your questions in the question box, and then at the end we'll review those and take some time to address any questions you have. If things come up after the webinar, please be happy to reach out to us and we'll answer questions that way as well. And I see a question already came in, so I'll answer yes, we are recording the webinar, and the recording will be available at the same link you registered at, which is on our website. So you can refer back to it later. If you could go to the next screen. A little bit about Spark Training. I see a lot of familiar names in our participant attendee list, but for those of you who don't know us, what I think makes us different as an organization is a handful of things, but one, with Railtasker, which is our software program, we are really committed to not only offering a software solution to help with compliance, but also the service, so that you're getting the most, not only about the products that we're offering, but guidance on FRA compliance. We work really closely with the FRA to ensure that what we're doing for the industry aligns with not only their guidelines, but best practices that go above and beyond the regulations. For today, we're going to be talking about CBD and marijuana. And for those of you who haven't heard, I think this is one of the common questions I'm getting is, yes, we are a third-party administrator, which means we're doing the clinic and on-site testing, as well as offering an expanded solution within Railtasker. With that, I will go ahead and hand it over to Holly for today's presentation, and thank you again for joining us.
Good afternoon, or good morning, I guess it is. Some of the things, I'm Holly Rainwater, and I am the Vice President of Drug and Alcohol Testing here at Spark. And this slide here just talks a little bit about what we do with our clinic testing, our on-site network, and we are strive to have those tech-driven solutions. In regards to our presentation today, let's see if I can flip to the next slide here. We're going to talk about marijuana. We're going to also talk about medical marijuana, cannabinoid, and then go through any questions and answers that anyone might have. I was putting the presentation together. There's lots of different things that we can talk about when it comes to marijuana. But one of the first things I wanted to do was go and maybe level set us and bring us back to the beginning in regards to drug and alcohol testing. And as a reminder, under the Department of Transportation, this regulation covers our safety sensitive employees, like our train engineers, our maintenance away pilots, school bus drivers, airline pilots, ship captains. It really has a broad range under the Department of Transportation that it covers. Where all of this where all of our drug testing rules came from in regards to what drugs are classified as a Schedule I drug or a Schedule V drug. It comes under the Controlled Substances Act. The CSA classifies all of our drugs, substances, and certain chemicals used to make drugs into 5 distinct categories. You've got either Schedule I, II, III, IV, or V. Schedule I drugs have a high potential for abuse, and they can also create severe psychological or physical dependence. As the drug schedule changes, like once you go to 2 to 3, etc., does that abuse potential. Schedule V have the least amount of abuse potential. And it's important to know that a Schedule I drug is illegal to use and possess under federal law. You can't walk into your pharmacy and pick up a Schedule I drug. You can't go in and pick up a prescription for marijuana. It's important to know that is a class of its own. And Schedules II through V are very common prescription drugs. Again, if we look at Schedule I, again, there's no medical use and high potential for use. We're talking about heroin, LSD, marijuana, ecstasy, and peyote. When you look at Schedule II, drugs with a high potential for use, And then you're talking about things like hydrocodone, oxycodone, Adderall, amphetamines, morphine, and fentanyl. Schedule 3 are a little bit less moderate or less high potential, so barbiturates, also like some codeine, like Tylenol with codeine. Schedule 4, they're more lower risk, like more benzodiazepines and tramadol. And then Schedule 5, there are a lot of these over the counter, Robitussin AC, and some medications used for diuretics. I bring this in here because I think it's important to understand that even though marijuana got all of these laws and regulations, until marijuana falls off the Schedule 1 drug list, it's always going to be prohibited under the Department of Transportation because it is that Schedule 1 drug. It has a high, again, I said this several times, high potential for use. And a lot of the issues come in now where we've got the legalization of marijuana in many states. If we take a look at the map, this is back on May 27th, the most recent statistics show that there's 38 states that have pending or completed regulations regarding medical or recreational marijuana. There's a lot of movement going around. Because of this medical marijuana concern, in 2009, DOT put out a notice that says, hey, even though that these states are authorizing the use of marijuana for medical use, DOT still says it's not, it is still prohibited, and that medical review officers cannot verify a drug test based on information that says they use it for medical marijuana. All DOT agencies prohibit it. Medical conditions, a lot of people use medical marijuana for these medical conditions like cancer, glaucoma, severe seizures. When somebody says, hey, what do you think about people that use medical marijuana? Or I'm a truck driver and I have seizures, so it would help me if I used medical marijuana for my condition. And I think what is important to understand is that if you look at that diagnosis, so if you have a diagnosis, a medical diagnosis that says, hey, you should use medical marijuana, then at that point, you should consider maybe you need to be on some sort of a medical leave of absence, or maybe if you've got a short-term disability policy, look at that and not use, and not perform that job. DOT says that you shouldn't be doing it, so maybe there's other ways to consider what you should do next. When we look at marijuana is produced by the cannabis sativa plant. When you have that marijuana, there are different components, okay? One of the components in marijuana is THC. That's that psychoactive component. That's that component that, gives you that feeling of being high. And one of the other components of THC is cannabinoid. And we call that, a lot of people know it as CBD oil, and that has different properties. So it doesn't have the I feel high feeling. It's more to treat conditions like with chronic pain. A lot of people use it if their muscles are sore or for depression. Some people are using it instead of pain relievers like oxycodone and tramadol. They're using cannabinoid instead of that. They don't have those, aren't using that Schedule 2 or 3 drug. The thing about cannabinoid is it's not regulated. Nobody is out going into these locations that are producing cannabinoid and making sure that there is no THC in the cannabinoid. What happens when that cannabinoid is extracted, THC is still attached in some form or fashion, so it's not going to be 100% THC free. You have to be very careful. So until that oversight happens, it's very possible that you might get a product that has THC in it. Because we don't have that stringent oversight, 0 THC may not be accurate. Also, the strength of THC in these products can vary considerably. And studies have shown that CBD products tend to contain THC levels of 0.03 or above. Excuse me. Now we've talked about CBD is ever emerging. There is one form of cannabinoid oil that is legal, and it's called Epidiolex. And it has not been approved by the, Epidiolex is the only CBD product approved. Others have not been approved. And the Food and Drug Administrator, Office of the Department of Drug and Alcohol Compliance put out a notice back in February of 20, and they said, hey, it remains unacceptable for any safety sensitive employee subject to Department of Transportation testing regulations to use marijuana, since the use of CBD products could lead to a positive drug test. Department of Transportation safety sensitive employees should exercise caution when considering whether to use CBD products. Really, it's a buyer beware. If you're going to use CBD, if you're going to go to the gas station, or you're going to go to the smoke shop or the drugstore and you're going to buy a product that has CBD in it, beware, because it might not be THC free. And I've had people in my career that I've talked to, an MRO who his wife was using CBD and she took a drug test and it came back positive. And then again, I know another person, she was taking CBD oil and she took a drug test and it came back negative. I think that's where we just have to be very careful about the use of this product. And again, DOT says, hey, the use of marijuana or possession is prohibited regardless of any state law. If you take that drug test and say, hey, I was using cannabis oil, and you send a screenshot to the MRO and there's what I'm taking, or you said, hey, I'm using medical marijuana, take a picture of it, it's still going to be a positive drug test. Now we can maybe talk about some questions and answers, and I did put this question, and this is, I feel that we've answered this question, but I'd like to just put this question out there. It says, will I pass a drug test if I use products containing CBD? Maybe or maybe not. Really, it is buyer beware, just be very careful. Until it's regulated, unless we can get to a situation where FDA or someone is out regulating CBD, you're never going to know what's in it. It could be somebody making it in their bathtub and not using a quality process to take out the THC. It's a person should be very careful if they use it. Katie, did we have any questions at all that may have come up?
No, I was just thinking, not yet. If there's questions, please send them in. But I was just thinking there's a lot of confusion and interest in this topic. And then as you're presenting it, I think DOT has just made it pretty straightforward. While it feels like there's a lot of ambiguity with state laws and CBD in particular, at the end of the day, from a DER perspective or from a DOT perspective, it seems like it's pretty straightforward. So maybe that's why we're not getting a whole lot of questions. I know we get conversation or requests for this topic often, but yeah, I'm not seeing anything. I guess that's, if you guys are thinking of something that's after the fact, please reach out to Holly or I, but I think it's as straightforward as it sounds. And I know for those of you with locations in Minnesota, like our laws here, if you're in Minnesota, like Holly and I have been changing recently, which I got some additional questions just from that. Again, an interesting topic, but when it comes to being a DER, it seems like it's pretty straightforward of how you should handle it. So, all right, thank you.
Thank you.